So I'm a gastroenterologist, and I practice and live in the suburbs of Detroit, Michigan. I'm a big sports fan.
He became the Rhodes Scholar representative as well as the homecoming king at Ohio State.
What we're trying to do is replicate what you would have, for example, in my office. You want to be real and answer questions that are tough sometimes. Take a topic and really understand it and develop a solution. At the end, we'll help the patient that's in front of us and also help the patients at home as well as in the studio audience. That's the essence of what we want to do. Hello everyone, welcome to Ask Dr. Nandi. Today, we'll deal with a disorder that affects 40 to 50 million people in the United States, acne. Acne and its treatment really dates back to ancient Greece and Egypt, and it continues to cause problems today. It's a skin condition that happens when the hair follicles are blocked with oil and dead skin cells. Comedones, commonly known as whiteheads and blackheads, or pustules, commonly known as pimples, are most commonly seen in patients. Acne can be a nuisance and even painful. It can result in scarring of the skin. Often, the disease affects social relationships and self-esteem. In extreme cases, it can even lead to depression or suicide. Acne commonly occurs during adolescence, but often continues into adulthood. So what causes acne? When hair follicles become blocked and oil and dead cells are present, what happens? This forms the environment for bacteria and inflammation. Now, there are certain factors that make acne worse. Hormones can trigger or worsen acne. Dairy products and carbohydrates, which increase the blood sugar, can also worsen acne. Also, medicines such as corticosteroids, they also can make the acne much worse. Who is at risk for acne? Teenagers and women before their menstrual cycle. Pregnant women are also at risk. A family history of acne increases your risk of acne, as well as stress. Now, stress can make acne worse, but doesn't necessarily cause it. What about treatment? Most treatment attempts to decrease the blockage of the follicle, treat the bacterial infection, decrease inflammation, and reduce the oil production. Now, there are various over-the-counter products as well as topical prescription medicines. Antibiotics can also help, as well as laser and light therapy. We have chemical peels and microdermabrasion. They can also be used. Now let's take a look at Desiree Hack and see how acne has affected her life. Please take a look.
My name is Desiree Hack, and I've had acne since I was 13. At first I thought it was like puberty, just kind of hormonal, I would get through it, but then it just turned out, it just kept getting worse. I kept getting bumps on my face, and it's really hard to feel good about yourself or want to go anywhere when you think people are just staring at your skin all the time. So it's extremely frustrating, when you spend so much money that I don't have to, buying things over the counter, buying things off television, going to doctors, getting facials. I've literally tried everything under the sun. I've put egg whites on my face, I've put honey on my face, I've done everything you could possibly think of. I've been on Accutane, which is really hard on your body, and anything I can try that might help, it just doesn't help. And it's just very disheartening to know that there's something on your skin that you can't take care of.
When we come back, we'll meet Desiree. Please don't go away.
You get the big red cystic ones that are under your skin, and honestly, I can be asleep at night and I can feel them just pulsating and throbbing, and I wake up and know, oh my gosh, I just got a huge zit on my face.
Thanks for staying with us. Welcome now to the show, Desiree Hack. Desiree, thanks for joining us.
Thanks
appreciate
for having
it.
me.
No problem. Could you let the studio audience here know, and also the audience at home, a little bit about who you are?
Well, personally,
Yeah.
I'm a nursing student. I'm almost done with
Great.
school. I graduate April 29th, so I'm really excited about that.
Excellent.
Thank you. I have an 11-month-old daughter at home, and she's great, so that's pretty much me.
Wow, you're taking care of your daughter and going to school. That's got to be challenging.
And taking care of my husband.
Second child? No, I'm just kidding.
Pretty
My wife
much,
said that to me.
yes.
I got
have two
3
children.
kids. That's
Yes,
good.
I have 2 children at home.
So we're talking about acne. When were you first affected with acne?
I started getting acne when I was about 13 years old. I kind of chalked it up to high school puberty, hormones. It began with a few minor bumps on my face, and then I would break out in the big cysts and had whiteheads and blackheads, and then I started getting these bumps all over my skin, and those are what I've been struggling with for like the last 13 years. So.
Were they painful? Tell me a little bit about them, because people who don't have acne just say, well, you just have, pimples. What's the big deal? Tell people about what that felt like.
It can be painful both physically and mentally. I mean, you get the big red cystic ones that are under your skin, and honestly, I can be asleep at night and I can feel them just pulsating and throbbing, and I can wake up and know, oh my gosh, I just got a huge zit on my face, and I will get up in the middle of the night and go in the bathroom just to check it out. And I'm one of those people, I know you're not supposed to, but I totally try and squeeze it to get something out, just so I can go to sleep and release the pressure.
It's that bad?
Oh yeah, it's terrible. They're extremely painful. But more so than being physically painful, it's the bumps all over my skin. It's just hard to go out in public and think that people are just staring at your face all the time.
Do they?
So,
Do they stare?
I mean, people I know tell me that, oh, I don't even notice it until, you point it out. But I think because I have acne, I notice if someone else does. So that's the only thing I notice on my skin, is that I have bumps all over my face, and there's nothing I can do about it. And I feel like people are just like, what is on her face? And that's all I can think of every time I'm talking to anybody.
You think that they're just looking right at your face, even if they're looking at your eyes.
Right.
An important point just bringing out, a lot of people feel, you have acne, what's the big deal? It's not only just physically symptomatic, or doesn't give you just physical symptoms, but emotionally. I mean, go everywhere you go, you're always thinking in the back of your mind, are people just looking at my face? What did that do for you? High school, it's a really tough time, because you're trying to find your own identity, and it's everything. I remember my high school days. I mean, I was bothered by a lot of different things. And now, what did that make you feel like? I mean, how did that change how you felt like at that formidable age?
I had a really good family growing up that kept me very positive about life, and I had a really good outlook, and I was always really happy and really fun. I mean, I was a cheerleader, so I wasn't, I was self-conscious about my skin, but I tried not to let it affect my life. Now, the times that I had really huge ones on my face and I didn't want to go to school, I totally played sick. Like, Mom, I can't, I have a stomach ache. Really, I just had a gigantic zit on my cheek or something. I didn't want anyone to see it, but I've always found that, to me, it's easier to point it out to someone, because I feel like if I say, oh my gosh, I have this huge zit on my face, then they won't be like, oh, she's trying to hide it with makeup. They're going to be like, oh, she knows she has it, and it's no big deal. I just feel like, I think it's a defense mechanism, telling people, I know it's there, it's so big, rather than them just staring at me, wondering.
So you were pretty active in high school. Again, important for those of you who are watching at home, if you had the same problem she did when you were a teenager, it may be difficult, but the key is to not let it affect your life, not have you say, oh, I don't want to do this, I don't want to be in public all the time. You were in a pretty public, activity, which is cheerleading, so you didn't let that stop you. How did you do that? How did you manage to do that? Because you knew you were still self-conscious. People were looking at you, and you felt like they saw this big zit. But what did you do that made you, overcome that?
Well, first of all, thankfully I'm a girl, so I can wear makeup, and they can cover them up. But I also I guess I just liked to be fun, and I liked to, I don't want to say try and be funny, but if I was just me and I just kind of acted like I didn't care what people thought, then no one did care. I was just really nice to everyone, and everyone was really nice to me. I don't think I ever had anyone really point out, oh my gosh, your acne is so bad. I would have close friends be like, oh, that thing is humongous, and I'm like, I know. But it really wasn't that bad. I tried not to let it bother me, take over my life, because I don't want to be someone who just sits at home being depressed about my skin. I'm not going to live my life based on what my skin looks like.
What would you tell somebody who's in your position? Would you tell the same thing? Don't worry about your skin and let that control your life?
Absolutely, and I know it's easier said than done. I've had so many people be like, we can't even tell, we don't even know you have it. But it doesn't matter what anyone else says. It matters what you think about yourself. So of course there are days that I don't want to leave the house. I don't want to go out with my friends. I don't want to go to the movies even though it's dark. I don't want to go anywhere. But I do. I don't want to go to the store without makeup on, but I do all the time.
That's
it's just, you just have to just not let it, rule your life.
That's great, great advice. And I guess to me, what you're saying to us is that, you in life, maybe you have acne, but somebody else has something else. You cannot let your obstacles rule your life, but rather say, how am I going to make my life so that the obstacles don't interfere with it, and I can live my life fully?
Exactly.
When we come back, we'll talk about the treatment that Desiree had and how she overcame acne. More when we come back. Don't go away.
I actually went to go fill the prescription, and at the time I was 16 and I didn't have great insurance, and it was like $400. So I just said, oh, forget that, I'll just try and treat it myself again.
Welcome back. We're talking with Desiree about her experience with acne. Now, before you must have seen a doctor at some point, but before you went to see a doctor, what kind of treatments did you use? Over-the-counter stuff?
I used everything you could possibly think of.
Yeah.
I used face masks, astringents, face washes. I was told to put honey on my face. I was told to put egg whites on my face. I did everything you could possibly think of.
Advice from everybody,
I got
right?
facials. Oh yeah, every one that I know at some point is like, oh, I had the same thing. Do this, and I did it.
It didn't work.
No, it didn't.
Nothing worked.
I ordered products off the television that.
Yeah, I was going to ask about that because full of, what is that? Jessica Simpson, everybody's on there. Did that stuff work for you?
No,
not at all.
Didn't do anything.
Nothing. And then so you got frustrated?
Yes, extremely.
And then what did you do? Did you go see? What did you do? Go see a doctor, regular doctor? Or?
No, I actually just went to like a local dermatologist clinic, and it wasn't the best experience because I don't know if it was a physician's assistant or the actual dermatologist came in, looked at my skin for 10 seconds, didn't listen to anything I said, wrote me a prescription for I have no idea what, and left the room. So that was my first experience with the dermatologist.
Well, here's and I'm sure you'll tell us that you didn't stay with the doctor, but key point, some people, even if that happens, they stay with that physician. If you have a physician that doesn't take the time and doesn't give you what you need, which is at least an explanation of what's going on, I mean, you need to really find somebody who does. And it's not to say that, this doctor is bad or good, it's just not what you need. You need somebody that tells you what your condition is, whether it's acne, whether it's arthritis, whether it's cancer. You need somebody to explain the condition, what to expect, and what the treatments are. And so this person, didn't spend any time. What happened? What did you do?
I actually went to go fill the prescription, and at the time I was 16 and I didn't have great insurance, and it was like $400. So I just said, oh, forget that, I'll just try and treat it myself again. And then I went to another dermatologist, and they were actually pretty good. I went on several topical medications first, and then they gave me some antibiotics, and then I went on Accutane. And that didn't really help anything either. I was constantly being given extractions where they poke my skin and extract as much as they can out, and the bumps would just come back the next day. So they were just back again. So currently I'm going to another dermatologist, a third dermatologist, who is treating me completely different, and her theory is different. The second dermatologist I saw told me that my bumps, which are my main priority, my main problem, were just hardened oil under my skin that just can't escape.
Okay.
And then this dermatologist is under the assumption that it's an autoimmune response to my body not being able to metabolize testosterone. So I got my blood levels checked. My testosterone's normal, but my body just can't metabolize it properly. So my body is actually attacking my pores. And so I'm just getting these bumps. So I'm actually being treated with something that inhibits the production of testosterone.
And has that been effective for you?
Yeah, so far my skin has looked better than it ever has before. So I've noticed that my bumps are fewer still there, but I have a lot less, and my skin is much more smooth than it used to be.
Yeah, it looks great.
So it's getting better. I don't know if it's going to be a problem that can ever be 100% solved, but it's definitely getting better, and I see an improvement. I feel much better about myself now that it's getting more clear.
Couple of points, that people think, with any kind of condition that you have just, a couple of medicines and it's going to work. Sometimes it takes perseverance. So what you have to do is, like you had to, go to different dermatologists and go to different treatments. And finally, you may find that one that works. When I treat people with inflammatory bowel disease, which is Crohn's disease, sometimes you have to go through that. You have to go through different medicines. People don't usually think about acne that way, but really it can be that way. Now, what is it done to your self-esteem now that it's better controlled? Now, you always could overcome it. Mm-hmm. How is it different than when you were 15 and now? I mean, what's your self-esteem like?
I definitely have good self-esteem, but again, that's due in a large part to my family and my husband. They're very supportive, and they always make me feel beautiful. I have to say though, it's more difficult as you age to have acne because people put this stigma on it that it's a childhood or a teenage kind of disorder, and they don't realize that it can follow you through adulthood. I mean, my mom is almost 60 and she still breaks out. So
she does?
Yeah, so I mean, it's certainly hereditary in my family, but I want to do everything I can because I don't want to be, 60 years old and still having breakouts. You know, I want to kind of nip it in the bud as quickly as possible. So my self-esteem is definitely better now that it's getting more clear. But before, when it was still really rough and bumpy, it was just really hard because you see, you go out with your friends and you're adults and they all have nice clear skin, and I'm still worried about, having this huge zit on my chin.
Yeah, it's important, and I wonder if there should be more, and this is, kind of a question as much as an answer, is that there should be more support groups. It's so many teenagers that are affected by it, but you really have nobody else to talk to. I mean, your mom had this problem, but besides, it would be nice to talk to your peers about it. And you did a great job in getting yourself, boosted enough that you could do everything you wanted to. But what would you tell America? Most Americans, I bet you, if you took a survey, would say, "Oh, acne is kind of a nuisance, not a big problem." What would you tell them? How would you educate them so they can help people like who you were when you were 13, 14, 15 years old? What would you tell them?
I would say that having acne and treating acne is a lot more complex than people think. It's not about wash your face and it'll get better. It's not about being unclean or being dirty. Sometimes it's very internal, and some people don't know what's going on with their body and what's going on with their skin, and it's really easy to pass judgment on someone when you've never gone through that type of heartache or that type of, upsetness about yourself.
Sure, no, exactly.
It's not easy. It's very disheartening to know that other people out there don't have to go through this struggle, and you have to, and you kind of feel like, why me? Why do I have to go through this,
And you want people to empathize, they want people to understand that, hey, this is a condition that it's not just a nuisance, but really can affect your life.
Yep.
And so well said. For those who are watching, if you have this problem or you know somebody who does, have the empathy, understand that it's not just this lesion that, oh, well, it'll go away, and that it can affect you on the inside as well. Do what you can to make them feel and not, be as self-conscious, and give them tools to support them. Great advice. Thank you very much for taking the time. No problem. When we come back, we'll have Dr. Wendy Sadoff. Please don't go away. Now, what do you think the most common cause, of acne, in your opinion? Welcome back to the show. We now have Dr. Wendy Sadoff. Thanks for coming back.
My pleasure.
Appreciate it. We're talking about acne, and our last guest was discussing her experience. It's very common. How common is it in your practice, would you say?
It's extremely common.
Yeah.
As a dermatologist, I treat acne all day long, and not just for the teenagers. Acne extends into the young adults. Even as she mentioned, her mother, who's 60, has acne, and we see that. So it's very, very common, and it gives us a great opportunity to offer the patients a lot of different treatments.
Now, what do you, when you have a patient that has mild acne versus serious, what kind of advice do you give them?
There's so many different types of acne, and you're right, as soon as I see them, I'm kind of putting in my mind, categorizing, is it mild, moderate, severe, but also what's the predominant lesion type? In other words, do they have mostly blackheads and whiteheads? Do they have more of the, as I call them, the juicy pink ones? Do they have the deep, painful nodules? Because different medications are really aimed at treating different lesion types. And I also look at the patient and I think, how bad, does it bother them? Because we're looking for, in the teenage population especially, for them to be compliant and consistent with a regimen. Right. So what will they do? Are they too busy with other things that they might not do something more complicated? So it's partly how severe the acne is, the lesion type, but just their general life demands and what they might use.
And also what their expectations are. I mean, if you have somebody who's really, really worried about it and it's affecting their self-esteem, you may treat them differently than somebody who's not. Now, there are lots of over-the-counter medicines for acne. If I'm having a problem, when should I see a dermatologist? When is it time?
Again, it depends on not only how much disease or how much acne you have, For one person, it might be just a couple of blemishes is bothering them so much that they really need to know that they're going to get it handled in the, in the physician's office and having access to all the treatments possible. Because, as you mentioned, acne really is a very upsetting condition, and it isn't necessarily correlating with the disease severity. In other words, you can have someone with 2 small blemishes who is more affected by their acne, staying away from others in school, staying away from activities. That may affect them more than someone who has much more significant condition. So again, even with just a few lesions, if it's bothering them, I think they should go to the dermatologist. It also helps for them to know I'm doing everything I can for it. If I make my appointment, I keep my regimen up to date, I give feedback to the doctor on what worked, what didn't. I'm doing everything I can, and that reduces a lot of the stress associated with it.
Absolutely. And great tips. We're pointing out again and again is this is a disease on the outside and the inside. It is essentially that even if you have a few lesions, it really doesn't matter, because what happens is that if it's affecting you on the inside, please see your doctor, please see your dermatologist. And what happens is that then you're empowering yourself, is what you're saying. You're saying,
Exactly.
this is no longer my fault. I'm doing everything I can to help with this so that it makes you feel better. Great thing. Now, what do you think the most common cause of acne, in your opinion?
Well, in general, it starts with under the influence of the hormones as a teenager. The oils that were previously so thin and like water are now sticky and waxy and clogging. And those oils and waxes, as well as the skin cells that line the hair follicle, get plug that opening.
Okay.
And you end up with a blackhead or whitehead. And then it becomes inflamed, and they can end up with cysts. So it's really just the hormones and changes that occur during adolescence and genetic tendencies. So there are some, the children.
Like Desiree, whose mom had acne at age 60. Okay.
And I think if an adult has had very severe acne, has suffered with acne scarring, they should certainly have their child seen by a physician sooner rather than later, so that any scarring is really prevented.
What about all of the misconceptions that it's all caused by stress, or that I ate chocolate and I had greasy foods and boom, it came on, and I got a zit right away? What about all those concepts? What are any truth, any of that?
Well, I think that's the tough thing about that. Oh, I ate this and then I got this terrible breakout is so unfortunate, because then again, the person, as well as feeling bad about themselves and how they look and staying away from others, now feels like they caused this or brought this all upon themselves. The studies looking at food and acne are pretty iffy for the most part, and I don't give any specific restrictions to my patients.
Good.
These are teenagers. I mean, they have a tough enough time. In general, we hope that they're eating, in a good, healthy way. But I don't say, well, if you ate pizza, that blemish is your own fault.
Exactly.
That was kind of, that was.
Because you have a tough enough time with body image and restricting this and that to begin with.
Right.
Important points that Dr. Sadoff is bringing up is that, number one, there's really no good evidence that any particular food really helps. There may be some tendencies in individuals, but really, across the board, no recommendations can be made. And it may be a problem just with who you are, in the sense that you're a teenager, you're going through this time, and the hormonal changes that occur with being a teenager may be causing some of these conditions to get to be where they are. And what you can do is go see your doctor, do the best you can, and importantly, have a good self-image. Don't blame yourself, or don't say that I'm doing something wrong. Great bits of advice. We have to take a break. When we come back, more with Dr. Sadoff. Please don't go away.
And I've seen kids get into a bad cycle of starting to apply any number of home remedies that can actually make the acne worse.
Thanks for staying with us. We're talking with Dr. Sadoff about acne. At the break, we were talking about something, we talked about when should people see a dermatologist. Why else do you think that people should see a dermatologist fairly early?
Well, as soon as it starts bothering the teenager, they start asking their friends, or their friends offer advice. And I've seen kids get into a bad cycle of starting to apply any number of home remedies that can actually make the acne worse. Whether it's toothpaste or hemorrhoid cream or egg whites.
Hemorrhoid cream.
It's
Nice.
on every blog. So that works, to reduce the inflammation of the blemishes. So they start using a lot of things that are, at the very least, not going to be effective and actually can make the acne worse. Then they start that cycle of picking and feeling very bad about what they're doing to their own skin. And that is a very difficult pattern to break.
It's unbelievable. And so the point, at home is that if you see your doctor early, it serves as a point of education. Education by breaking all the myths and education about not using all these. Desiree talked about every single person has advice for you about what worked for them, and it's 100% and it doesn't work for you. So great points. Now, the psychological aspects, we touched on that, of this disorder or condition can be significant. Do you see that a lot in your patients?
I see that all the time. Sometimes a patient is more forthcoming with that, saying, I'm missing school, I don't want to try out for some activity, but you can really sense it in the patients. And as they improve, you sense the release of that and that they've actually become more social. Sometimes it's even in body language. They come in and kind of all into themselves, and as their skin clears, they're more open. They may even shake my hand. They're much more outgoing. It's a beautiful thing to watch.
The nonverbal cues that you can see.
Exactly. And sometimes there are situations where it doesn't really seem to bother the patient, the teenager, but it bothers the mom or dad. And then that creates some discord in the home. So there's always some kind of psychological something going on.
How do you deal with that when it affects the mom or dad? What do you do then?
Well, there's no way, if it doesn't bother the child at all, and you have to kind of assess whether they're just not telling you that it does, but if it really doesn't bother that kid, he's not going to use his medications. And just that hassling and hammering on the child isn't really going to, it's just going to be a lot of frustration for the parent. So I basically say to the kid, I'd like to treat your acne. I think that you'd be really happy with clearer skin. And if you can see your way to wanting that or being consistent with a regimen, let's do it.
But you don't force them. You don't. At least what I'm reading is that if the parents are the ones who are more the ones who are worried about it, you don't say to the kids you have to do it, but rather on their own terms. Is that right?
Right. Because the other way that it goes is that you prescribe several medications. The parent pays these co-pays and the office visits, and then the kid isn't using them, and then they're at each other's throats about all the time that they've taken and money that they've spent, and it's not being used. So I think you have to establish in the beginning, are we treating now? Are we kind of going forward?
What your goals are.
Yeah.
I would also say even more, I would say if I were the parent, if your child is not bothered by acne, one of the biggest problems with acne is the psychological effects. If you are, hammering your kid about the fact that you don't look the way I want you to, I mean, that's going to be more adversely affecting the child rather than the acne. So, if you're watching at home, if this is something that's happening to you where your child's appearance is bothering you, don't hammer them, because this disease affects you psychologically, sometimes inside more than the outside. So I mean, I'm dismayed. I didn't know that happened very frequently. If it does, it makes me feel really bad for the kids. What can the viewers at home do to prevent acne? Is there any advice that you can give them to prevent breakouts or even prevent acne from coming on?
Well, they're going to get acne because 80% from 11 to 30 are going to have acne. So you're going to have that tendency to a greater or lesser degree depending upon, like I said, your genetic factors. And it's important to know it's not a hygiene issue. So I can't just say clean your face more. But what I can say is at least just keep your skin, just do a regular face wash and don't apply things that make acne worse. So there are things that we do. Well, if we over cleanse, or for girls, they start to use a lot of concealers and things that are very clogging, or different types of makeup, or different oily products on the skin. Even if you're just avoiding those, comedogenic is the word we use. So avoid comedogenic products, or look on a label for non-comedogenic products. That's helpful. But you're going to get some acne, and then just seek advice on what to do to avoid it getting worse, avoid it scarring.
Perfect. So good advice. You know that the majority of people are going to get the acne. So instead of harping on it and saying how am I going to prevent it, just do what you can. Use a simple cleanser. Use general principles of cleaning your face, but don't go crazy doing it. And then if you're somebody who really worries about the appearance, don't do things that could actually bring on the acne even worse. We don't have much time, but any thoughts on alternative treatments for acne? What do you think about that?
I don't advise any alternative or plant-based or that type of thing. I think that there's some good regular treatments, prescription and over-the-counter, whether it's benzoyl peroxide over-the-counter or a vitamin A derivative called a retinoid. That's a prescription strength. So I kind of stay mainstream with acne treatments. The only thing I would say is that some of the acids, glycolic acid, salicylic acid, and those can be, like glycolic acid is more of a plant-based or natural acid. That I do believe in. I think that's a really great product to take away the stickiness of the oil in the cells and at the very least unclog the pores and also make the medications penetrate a little bit better.
Perfect. Great advice. I really appreciate everything and your insight about this disease. When we come back, we'll have questions we'll answer from the studio audience. Please don't go away. I have some adult acne. I say, you know what, I have all the problems of an adolescent, but none of the benefits. You wonder, I should have outgrown this. How come it's still happening? Welcome back. We're now back to take questions from our studio audience. Yes, sir.
Doctor, how do I get rid of blackheads and then keep them from coming back?
That's a real common concern. Well, almost everyone has something they can extrude from their pores. So some people think they have blackheads or blocked pores because they're squeezing and they're getting sebum or oil out. So you don't have to do, that is actually normal. But if you really have a plugged pore or blackheads, I think some of the acid products that are out there, glycolic acid, salicylic acid, are really helpful.
Great advice. You know what? And the other idea is that if you're having those questions, again, be proactive, see your doctor early so you can get education. Now, is it different when you have kids that come in with these kind of concerns versus adults? Do you do anything differently?
Excuse me, I do. The teenage skin is likely to be more oily, more tolerant of some of the stronger acne medications, and less likely to get irritated. Whereas as we get older, we may develop more sensitivities. So I have to offer different things to the more sensitive skin adult patients.
Perfect. Next question.
Hi, doctors. Actually, that was my question. I wondered what the difference in treatments were for adults as opposed to children.
Well, keep going. Anything else you would say about that? I mean, because you have the same disease that just extends to adults.
Well, there may be different triggers, and specifically, and this may be part of your question or apply to you, adult women out of our teen years getting acne. There may be more of a hormonal component, and I think that was spoken to a little bit earlier with, using treatments that may affect that trigger for acne. So sometimes we do offer adult women things that will address the hormonal stress factor for their acne.
Let me ask you one thing about the difference. Now, is the self-esteem factor different from adults than children?
It can be extreme on both ends. In some ways, they have different pressures on them. Our children have pressures in terms of school. They're selecting courses and activities, and they want to feel good about themselves. And although a girl can put on some makeup, she doesn't want to go with caked makeup to school, and certainly not to junior high. Adults have other pressures on them, job interviews, and they don't want to go to a job interview with a big blemish on their cheek. Or in their career, maybe they are doing something in front of the public eye. So they have different pressures, but it really is, I see just as much effect on their psyche and pressure on them in terms of the acne with adults as I do with the kids.
Now, what about the fact that most people think, well, I should have outgrown this, and why do I still have it? I mean, this sense of frustration, because I've always said, whenever I have some adult acne, I say, you know what, I have all the problems of an adolescent, but none of the benefits. You wonder, I should have outgrown this. How come it's
Right.
still happening? How do you deal with that?
Well, I tell people that you grow out of some things and you grow into others. And some people, I mean, acne in adults is commonplace. It is not just a teenage condition.
Sure.
So I have a lot of patients who are saying, okay, now I need something that can target the acne and the wrinkles, and that's unfair.
Oh, that's unfair.
That I'm on, having both
Both at the
issues
same
at
time.
the same time. But it happens all the time. And there actually are products that can address
Both.
skin aging and a tendency for acne. So
That's great.
that's great too.
Next question. Yes, sir.
Hello, doctors.
Hi.
Can acne run in families?
What do you think, Dr. Sadov? The family history, I know that Desiree had a mom that was
Right.
still having acne in her 60s.
I think that that is a real big factor, and the opportunity in that is that as an adult, if I've had severe acne and I've had to deal with that, get my kid in there fast, because sometimes the acne doesn't look so severe when you look at the patient, but it can lead to scarring, and it can be, let me say, underappreciated in terms of the potential for scarring. So I think that the genetic tendency is really strong, and I just would use it as an opportunity for early intervention.
So again, we've talked about this again and again. You can't change the cards you're dealt, right? And so it's what you do when you have this tendency. Do you sit back and say, I'm going to get it and just do nothing about it? Be proactive again. But the other key is don't let it become so encompassing that every time you get a lesion that you think this is what's going to happen if somebody in your family has had a bad attack. But rather take the information, understand that you may be more at risk, but try to take that information and go see your dermatologist or your doctor maybe a little quicker. Would you agree?
Absolutely, and I also would urge parents that even if they don't remember, or maybe it didn't bother them, or maybe because people didn't treat it as much
That's right.
back then, don't assume that it doesn't bother your child, or that they will be similarly affected or not affected as you were. So some people say, well, I went through it, I dealt
not a
with
big
it.
deal.
Well, that may not be the same experience that your child is having.
It's a great bit of advice. You know what? And kids nowadays may have different pressures than their parents did. And so acknowledge the problem, address it. Again, don't let it take over their lives, but really be an advocate for them so they don't go into this depression or decreased self-esteem. We have to take a break. When we come back, more questions from our studio audience. Please don't go away.
So if you strip your skin of all the natural oils because you think that it's just because your skin is too oily or dirty, then I give you a medication that you're supposed to apply. That medication is more likely to be irritating, causing redness and itching and scale.
Welcome back. We have more questions from our studio audience. Yes, ma'am.
Hi, doctors. Is acne caused from stress then, or they're not washing properly?
That's a great question. It's a big myth. What do you think about that? Is acne caused by stress or not washing properly or being unclean?
Well, so two parts. The stress. I think stress does play a role in acne. And so I would say it's not caused by stress. And I think that's important to note, but it certainly can be aggravated by stress. It's a hard thing though when a patient asks me, which they do all day long, can this be caused by stress? And I basically say it's not caused by, but it's not being helped by your stress, especially if the stress is resulting in you picking at your skin, becoming anxious, being upset about it. And the thing that's tough about saying, yes, it's caused by stress, is the stress is already a difficult thing that you're dealing with. And then to say now it's causing you your acne. So it's like the job was already bad enough, it was stressful, now it's causing me my acne, is really a tough thing for a patient to hear. So how I deal with it, as I say, it probably is a trigger for your acne. How can we look at reducing that stress? What's going on? And sometimes a person needs some help in dealing with that. But if the stress is resulting in picking and that anxiety and in front of the mirror where they can't stop picking, I oftentimes will recommend a sign on the mirror to remind them not to do it, and then maybe offer them a clay-based mask, something that would be soothing and improve their acne, so that when they feel like picking, they can maybe apply a treatment that's safe and beneficial that they can do at home. They get 15 minutes to kind of chill and reduce their stress and calm down, and then they can splash it off, and then they've revealed skin that's calm, not been picked at, and they can then feel that they've done something positive for their skin as opposed to been aggravated, stressed out, anxious, picked their skin, and then look what I did to myself kind of thing, because that leads to more stress, leads to more breakouts, leads to more picking, leads to more, it's a bad cycle.
It's a great tip. You know what, that stress will not cause it, but can make it worse. And the other caveat is that when you're stressed, you're picking at things, and the more you pick, the worse it gets. The second part of that question is that, am I just not cleaning myself properly? And Desiree kind of pointed to that. You know, you feel like people look at you and say, are they just not very clean? I wish they just washed their face. And it's a complete myth. You know, of course, use gentle cleaners, but don't get in the habit that people think I'm not clean enough, and maybe I'm not clean enough, and scrub. And what does scrubbing do and making vigorous cleaning? It actually makes it worse, right?
It can really make it worse, and also leave your skin in a state that it won't tolerate the medications that we prescribe. So if you strip your skin of all the natural oils because you think that it's just because your skin is too oily or dirty, then I give you a medication that you're supposed to apply. That medication is more likely to be irritating, causing redness and itching and scale, and not be able to be tolerated, so that you won't benefit from it. Exactly. So just a gentle cleansing that it actually maintains what I'll call the skin barrier, and then apply the acne medications.
Perfect. Another question. Yes, ma'am, please.
Hi, doctors. Are there certain foods I should avoid for acne? I even tried becoming a vegan, and I still have acne.
Another maybe a myth out there about foods. I'll let you address that. What do you think about foods like don't have greasy foods, don't have chocolate? What do you think about that?
I think it's all part of kind of what can I do to control my disease to make it stop. So can I wash more, change my diet? You know, it's just you don't feel like you're in control of this, and to a certain extent you're not. Changing your diet, I don't believe, is going to really lead to a great impact, positive or negative, on your acne. I do recommend just a general healthy diet. If someone is really, you know, just living on fast food, that's not going to be healthy for their body or their skin in general. But a specific diet, especially for someone like a teenager that has a difficult time with that, I do not recommend. There are some people, though, that say, you know what, when I eat peanuts, I break out, and that makes sense to me, you know, and I say, then watch how many peanuts you eat. I mean, you can adjust it without really going to a dramatic restrictive diet. So I think it's all part of trying to get control on the condition.
Exactly. You know, and in summary, again, you know, no evidence overwhelmingly that any foods make a difference. There's a bit of evidence that maybe some carbohydrate-rich foods can make a difference if they make your blood sugars go up. But again, not across the board. So I agree. Don't restrict foods that, you know, we don't know that it will actually make a difference, especially with adolescents. Well, this time I'd like to thank my guests, Desiree Hack and Dr. Sadoff. Thank you again for all your time. Really appreciate it. When we come back, Partha's Prescriptions. Please don't go away. Welcome back. Acne can be a real problem for millions of Americans. What can we take away on today's Partha's Prescriptions? First, if your acne is not being treated with over-the-counter medicines, please see a doctor. There are effective treatments that are available today. Second, don't let your acne affect who you are. Don't allow this disease to change your self-esteem. If you feel dejected or frustrated by acne bouts, please see your doctor. Although tempting, don't squeeze to get it out. Wait for treatment to work. Squeezing may leave a scar. In general, patients with acne shouldn't pick, scratch, pop, or squeeze your acne bouts. Lastly, clean gently. Scrubbing your skin will not get rid of acne. In fact, it can irritate the skin and make your acne worse. Finally, there's a beautiful word in the Hindi language that literally means the light in me honors the light in you. That word is namaste. So namaste to each and every one of you. For more information on the treatment of acne or an archive of our previous topics, please visit our website at www.askdrnandy.com. Also, visit us on our Facebook and Twitter site. Thank you very much.